Hello, I'm Brett Sadowski, resident editor for the Journal of Graduate Medical Education. Today I'm privileged to be joined by Dr. Christine March and Dr. Stephanie Dewar, the lead and senior authors for June's Spotlight on Authors paper entitled An Experiential Communication Curriculum Improves Resident Preparedness to Confront Discriminatory Comments in the Workplace. Dr. March is a pediatric endocrinology fellow and former chief resident in pediatrics at Children's Hospital of Pittsburgh, and Dr. Dewar is the pediatric residency program director and associate professor of pediatrics, as well as the vice chair for clinical affairs at the University of Pittsburgh School of Medicine and Children's Hospital of Pittsburgh. Doctors March and Dewar, thank you for joining us today.
Thank you for having us.
You're welcome. It's our pleasure to be here.
Your paper addresses a critically important topic within medical training and indeed the medical field in general. What made you want to study this topic?
Well, the origin for this study came about for a couple of reasons. First, we have actually had a few circumstances where residents at our institution experienced discriminatory comments from patients or families that they were taking care of. And as you can imagine, those were very traumatic experiences for them. So it was at the forefront of program leadership's mind that these events do happen. And it really came to a head after the shooting in Orlando. We actually had a resident debriefing about that event, as many of our residents were deeply affected by that and by prior incidents. And in the course of that conversation, our residents asked us for help. They said that these situations happen where discrimination occurs in the workplace, and they didn't know what to do, what to say, how to act. So we spent some time reflecting on this, and as a program, we realized that many of us have experienced these sorts of situations, and it is truly very difficult to know what to do, and they're very uncomfortable. Dr. Dewar actually had the brilliant idea to then integrate this scenario into our pre-existing communication skills curriculum.
And fortunately and unfortunately, what happened in the program is it highlighted the fact that we as a faculty actually didn't have the answers as to how to respond to these situations. And so this was a group of physicians, not just residents, but also fellows and faculty who were very interested in learning how to respond to these situations and perhaps help to support families while addressing these comments and thoughts.
What do you think the implications of your work are for program directors across the multiple specialties within the practice of medicine?
I think the most important thing for program directors is to recognize the frequency of which these types of comments are made in front of primarily trainees, but also residents, fellows, and also faculty members. And it's important as we as a program move forward to recruit a more diverse group of residents to recognize that these situations unfortunately may continue to happen. As a program director, I was shocked and surprised at the frequency with which our residents reported experiencing these types of comments, not just directed at them, but also perhaps at one of their colleagues. And so in this day and age, it's really important for people to understand how to receive comments like this, but to continue to have a therapeutic alliance with the patient and the family, but also to make it clear that as a residency training program or as an institution, we feel very strongly that everyone should be treated with dignity and respect.
Now, I know you mentioned that it was your trainees who kind of were looking for guidance when you developed this program, and so I'm wondering what your work, the impact of your work has had on your trainees, and what can you advise trainees across the country who may be looking to get this sort of similar training?
Well, as Dr. Dewar mentioned, I think that all of us realized as we had this conversation with the residency program that these comments are happening a lot more frequently than we thought. The residents who responded to our survey, a little over half of them had personally experienced a form of discrimination in the workplace during their training already, and a little over 2/3 had witnessed at least one discriminatory comment. There were many residents who reported having these situations happen to them multiple times. And the discrimination happened over a variety of different forms. It was with gender, race, ethnicity, religion, age as well. I think the question then for trainees is not if this might happen to you during your training, but when it might happen to you during your training. And these are situations that you remember. They are very distressing. They stick with you. And it's hard to get through that, but we thought it might be helpful for trainees to feel in some way prepared. So the thought with a communication skills training course is that we give trainees a safe environment where they can practice different techniques. They can have do-overs, they can pause, they can reflect, and try to figure out a way that they can handle this sort of situation in a professional manner. And my hope then is that they develop some scripts that they can fall back on when one of these situations arise that is extremely stressful.
And I think the most important thing for not just trainees, but also program directors and faculty to recognize is that this is not a course just for people who are in a minority who may be the victim of prejudice comments or thoughts and feelings, but probably even more importantly for those of us who don't find ourselves in a particular minority, to be comfortable speaking up for our colleagues who may or may not be present in the room when a comment like this is made. It might be about that person on the overnight team that they don't want to touch their baby again. And it's important for us to advocate for them as a valued member of our team and make it very clear that we don't discriminate based on race, ethnicity, religion, gender identity, sexual orientation, any of those things, and that those people are very capable members of the care team. And so I think probably it's most important for those of us in the majority to be very comfortable advocating for our colleagues.